Hello, this is Jason Atwell. This is June 15th, 2020. This is my week one recap. This is my notes page, just topics and examples to be covered, and just a timer to keep me on track. So welcome Dr. R and anyone else who might be viewing. Disease definition. So disease is something that causes a change in homeostasis and balance, usually causing changes in form and function. Disease definition together would be a short phrase that would describe the location, dysfunction, and impact. So my example was acute patellar bursitis, acute being kind of localized inflammation around your kneecap, the sacs inside your joint. Disease classification are these are classifications that tie similar diseases together based on different categories. So they can be topographic, location on the body; physiologic, how they change function; pathologic, how it spreads in terms of pathogenesis. The example I found was juristic, how the environment or social environment impacts, and that would be an example of asbestos-related pleural disease. So asbestos dust getting into contractors' lungs and causing similar presentations of signs and symptoms. Etiology is the root cause of a disease. That can be viral, bacterial, genetic. My example that I found through research was NIH considers smoking, rather than a risk factor, they consider it an etiological root cause of heart disease. Pathogenesis, that's how the disease progresses. It's the sequence of events and changes that are expected. My example would be COVID-19 for my A&P 202 class. I found out that it attacks ACE cells via perforins and kind of hides out in your lung area and then causes a cytokine storm and an immunological response. That's kind of how it's expected to get in and work its sequence of events. Symptoms are complaints reported by the patient that are not observed. And so that's headache, abdominal pain are examples of that. Signs, these are observed by a medical professional in person, and they are typically measured or described. So that can be growths described or measured by the length, or blood count, or one that overlaps is fever. You can have a symptom fever that wasn't measured or noted by a medical observer, and a measured fever that is then a sign. A syndrome is a collection of signs and symptoms that kind of present together for a particular disease. So my example was irritable bowel syndrome has a collection of gastrointestinal symptoms that a patient usually describes in terms of abdominal pain and lack of absorbing nutrients and diarrhea, etc. That would be a syndrome. Diagnosis is when a medical professional determines with a certain likelihood that a particular disease is causing their presentations of signs and symptoms. So diagnosis, I went with was macular degeneration. Both my grandparents have it, and unlike other eye diseases, it has a very specific pattern of signs and symptoms. So it doesn't match glaucoma, rather it matches macular degeneration. There's like a grid pattern, and it's the way the lines kind of blur into each other, which is unique to macular degeneration. So it's with likelihood it's causing their signs and symptoms. Complications. Complications are indirect effects of either the core disease or treatment that are kind of a little bit on the outskirts of the core classic signs and symptoms, or they are additional signs and symptoms related to treatment. So a complication of chemotherapy would be lethargy, hair loss, and other things when you suppress your immune system. Prognosis is the anticipated outcome for the disease and the patient, regardless of treatment, but typically includes treatment. It would also include kind of their demographics and their current state and how the disease has progressed, etc. So prognosis, I came up with differentiation was local basal cell carcinoma versus advanced melanoma. Basal cell carcinoma has a pretty positive prognosis, a low morbidity mortality, and advanced melanoma has a little higher morbidity and mortality based on current treatments out there. So the quality of life is better for the first and a little worse for the second, depending on various factors. And then finally, diagnostic test is medical intervention first and foremost, and it can use to do differential diagnosis, detection, and or just monitoring. My wife, my example would be she's switching her medication for her rheumatoid arthritis to methotrexate, which is going to require bi-monthly and monthly monitoring of blood count, protein, creatines in her blood system. So that's it. I think I hit the 5-minute mark exactly. It was hard to keep it right on time. But thank you for watching. Bye.